Well, I first became interested in becoming a physician back in high school. I have a number of physicians actually in my family, but a particular influence on me was my grandfather. He was an internist who took a liking to cardiology back in his hometown, which was a small town. He was well-respected, generous, and loved throughout the community, and he really inspired me to become a physician. It's great to be a part of a large group because I have a number of physicians I can bounce questions off of. We've all trained at different specialty academic centers throughout the country, which gives the group a combined vast experience. And occasionally we do run into very difficult cases in gastroenterology and hepatology, and it's great to have this bank of knowledge, to work alongside with. One of the other benefits of joining such a large group is it allows us to provide cutting-edge technology for our patients. Every physician kind of has their own niche beyond just general gastroenterology and hepatology. We have physicians that focus on the liver, that focus in on inflammatory bowel disease. I myself focus in on endoscopic ultrasound. So endoscopic ultrasound is a technology in GI which has been around for some time now, but has really blossomed in the last, I would say, 10 to 15 years. Initially, it was mainly used for diagnostics, as it still is, diagnosing what types of tumors patients may have, what type of cysts patients may have in their pancreas. It can image and biopsy anything that's right next to the GI tract, which include the liver, the pancreas, bile ducts, adrenal glands, as well as up in the chest area, the esophagus. You can get biopsies of lymph nodes to diagnose cancers or sarcoidosis or different infectious diseases. The other part of endoscopic ultrasound, which is really exciting to me and where my interest really lies, is the therapeutics that it offers to patients now. Initially, it was designed for diagnostics, but has expanded into the realm of therapy, which includes draining cysts or alleviating pain by doing nerve blocks for pancreatic cancer and various other things that can be done. These are things that initially were treated with surgery, and now we can avoid some of these major scars and surgical issues with this new technology. My ultimate goal in taking care of patients is to make them part of the decision-making process and allow them to understand, what exactly is going on with their illness or symptoms. Right from the get-go, I want to make sure the patient understands, why I'm doing what I'm doing, why certain tests are ordered, and why certain therapies are being used on them. I remember back in gastroenterology fellowship, my training back in New Jersey, there was one time where I took care of a couple of World War II vets. They were in their 80s and 90s and were older, but I had some GI complaints, and I was so happy to work with them to improve their quality of life. Through the process, I got to know them. They told me stories of when they were young men in the military, and it was really inspiring, and I was glad I could help out these great gentlemen.